Good afternoon, I'm Paola Pisani. I would like to thank you, Professor Denison, for your introduction. Well, radiofrequency echographic multispectrometry technology, REMS, allows us to assess the fragility of bone macroarchitecture through a dedicated parameter called the fragility score, which ranges from 0 to 100 according to the fragility of the investigated bone. The aim of this study was to investigate the capability of the fragility score to discriminate between patients with and without fractures by comparing its performance with that of the ESCEO and the REMS score. To this purpose, 322 Caucasian men aged over 55 years were enrolled. Each of them underwent 2 diagnostic investigations: a DXA lumbar spine in order to assess T-score value, and a transabdominal scan by REMS technology in order to assess both fragility score values and T-score. Then, the incidence of fragility fracture was monitored during a 5-year follow-up. After that, all the patients were divided and stratified in 2 subgroups, fractured and not fractured patients. So, the fragility score capability to correctly discriminate between fractured and not fractured patients in comparison with DXA and REMS scores was evaluated by ROC analysis and related area under the curve. During the follow-up, an incidence of osteoporotic fracture equal about 70% was detected. In this table, we find the REMS-based fragility score values together with the REMS T-score and DXA T-score measured in both groups, fractured and not fractured ones. In particular, as we can see, significantly lower T-score values were detected in fractured patients with respect to not fractured ones. And on the contrary, as expected, fragility score values resulted higher in fractured patients with respect to not fractured ones, confirming the compromised structure of fractured patients. The ROC curve analysis showed that an AUC of 0.81 was associated to REMS-based fragility score. It is significantly higher than that shown for REMS and DEXA T-score. That was 0.62 and 0.61 respectively. This data confirming the capability of fragility score to effectively prevent the occurrence of fractures. So, to conclude, this study showed the superior performance of the fragility score compared to other T-scores for the identification of patients with and without fractures. So, the integration of fragility score into clinical routine can favor timely diagnosis and fracture risk prevention. Thank you for your attention.
Any questions? Is the REMS validated for each BMI, or it's not possible to use it for extreme BMI?
Thank you for your question. Yes, REMS technology has been validated for each BMI, for underweight to obese patients.
Do you have any plans to replicate this study in other populations of men, or?
We have applied this study also in a larger population. In fact, we have also published a very recently published paper from 30 to 90 years, and the results are overlapping.
Thank you.
You're welcome.